5 minutes.
Then you got to put it back on.
No, I will do it.
Oh, just the bandage.
Yeah. Are we all good?
Yeah.
Okay. First layer. Yes, this is the protective skin. Then Togos. Sorry, it's a bit worn out from all the users. I should be switching the users.
Do you sit on the floor to do it?
Usually I sit on the floor. So usually we will do this until it is white. Depending on the condition of this, I will just wind it until it's clear. So that's enough complexion. My little toes.
Each toe, how many times?
2 to 3 times.
And this is for compression or to keep them from being stuck together?
It's for the compression. It does help a bit because my toes get a bit puffy.
Yes.
So I need to do the bandaging. And so if you look at my compression garment and see the toes also.
So,
It's specialized with the toes.
It's a customized garment.
Yes, it's a customized garment. This is the foam layer to distribute the pressure evenly, and also as an additional cushion layer from the bandaging. Let's go up. The original color is white. It's not meant to be this yellow. This is what happens when you use it for too long.
So this is for night time or also during the day?
I will do it at night. I prefer to wear this in the day for ease of movement. Otherwise, the thing about bandaging is that if you move around too much, the bandages, yeah, I think everyone knows it starts sliding down. Then these are the short stretch bandages. That, yeah, so this will be the final layer. And going around here.
How often do you have to get new, like change to new bandages?
When it stops being elastic. So for me, it is about every 3 months or so.
Okay.
Because I don't move much in there. I bandage and then I go to bed. So actually they retain the elasticity. Yeah, so we're doing a figure 8 with even spacing between the bandages. My first layer. Second one is increasing size. So you can see the small one, the medium one, and the big one.
oh,
Long way.
So do you stretch now when you put the bandage?
Yes.
Or you just put
I'm stretching it.
you stretch? I think you actually have two or the
Yeah, and you can see me. Sorry, I'm doing a bit fast, so I'm a bit pulling it, depending, and
How do you know how much to stretch?
So it
yes.
takes learning. You have to learn, right?
Because my leg cannot really take that high compression, so usually I will only pull a little bit. I realize if I compress too much, it will start to pain. So it varies according to your own condition as well. So we do a figure 8. And my knee has to be bent for this part, so that when I do this, I won't get stuck.
You have, yeah.
Right? Baron would say use masking tape.
Yeah.
This is micropore tape. It's more expensive. Alright, last layer. Let's go down a bit. Making sure that it's evenly spaced and it's not wrinkled up. So I will just go this way. Yeah, I usually have leftovers, so I will go down. So the compression has to be highest at this part, and then as it goes upwards, it gets lower, so that the lymph fluid does flow back.
Is the elastics also tighter at the bottom and
Yes,
looser at the
it
top?
is. That's why the sizes go up also. Because when I'm up, I actually space it further apart. This one is just one.
Very clear.
Speed up, finish faster than me.
You're finished too. It's done.
Done.
Yes. They're both
Oh
done.
no. Yeah, I forgot to take peeling tape into account.
Yeah, this is very easy because we're demonstrating.
Twice. Really?
Alright.
Sarah say you have to do it one more round.
Well done.
Yeah.